In today's Health Watch, we'll take a look at a new study showing diabetes and weight loss drugs like Mounjaro and Ozempic may also help patients suffering from addiction. CBS News contributor, that's Dr. Celine Gounder, editor-at-large for Public Health at KFF. Health News is with us with the latest on this. A lot of people listening to this saying more good news when it comes to these drugs. What did the study show specifically about this?
So this was a study looking back over almost 10 years of data from patients in over 100 health systems across the country. So a huge data set. And what they found is people who had issues with alcohol use disorder, we saw a 50% drop in incidence of alcohol intoxication where they had to go to the hospital, and a 40% drop for people who had opioid use disorder of opioid overdose. So these are significant clinical impacts for patients.
So in the future, can you see people being prescribed this medication for addiction even if they don't have obesity or diabetes?
Possibly. I think we would need to see some randomized clinical trials over time to prove that this is truly cause and effect. That's what you would need also for the FDA to expand the indication, which paves the way also for insurance coverage. But I think it's quite possible we see that down the line.
Other than the cost, which we keep hearing is astronomical, I'm trying to figure out the downside because the research shows it has helped with heart health, cardiovascular, stroke, and sleep apnea. Mm-hmm. Other than the cost, and the cost is outrageous right now, what is the downside to taking these drugs?
Well, these drugs are working on the brain, and we don't know what the long-term effects of having this kind of hormone impacting your brain would be. We don't know what the risks for long-term in the long-term for cancer would be. We know that there are risks of pancreatitis, gallbladder issues, kidney issues, and there are some reports of suicidal thoughts. So that would be a concern.
Are you surprised as a doctor about seeing all that the good these drugs can do? Does it surprise you?
Yes and no. I think it remains to be seen.
All right. Dr. Celine Gounder, always good to have you here. Thank you so much.